When your pet has nausea or vomiting or just not eating well, your vet's going to recommend probably Cerenia or Mirtazapine or Zofran. But which one do you need? Well, which one you need depends on the situation. So in my practice, I encounter a lot of older animals, and most of the older animals, the dogs and cats, when they're older and not eating well, it's usually kidney disease or kidney failure. And in the past, I've used Serenia for the nausea that comes from this. But over the past few years, I'm seeing so many of my patients come home from the regular vet, and they've been sent home with Mirtazapine for the nausea. And I don't feel like it works as well. So let's talk about why. First of all, it's human nature that your vet gets in the habit of using one of these drugs more often than the other. They become comfortable with one of these drugs because they're all labeled as anti-nausea, but they're not really all anti-nausea, even though they're labeled as that and they're promoted as that. So your vet gets in the habit of using one of these for all nausea and vomiting related conditions. And they don't all work equally. It depends on what's wrong. So you need to know exactly what's wrong, why the pet is vomiting or why the pet is just not eating well. And you need to know exactly what each three of these drugs do to know which one's going to work in the individual situation. I've discussed in earlier videos about what's happening when the kidneys aren't working properly. And I talked about this in the blood work videos, especially the BUN and the creatinine videos, and why kidney disease causes inappetence. And it's because, briefly, if the kidneys aren't removing the metabolic waste from the bloodstream, all those metabolic wastes circulating in the blood just causes a feeling of illness or weakness or nausea or inappetence. And remember here, nausea doesn't have to mean vomiting. Your vet may say, we need an anti-nausea medication, and you may think, well, my cat's not vomiting. Well, think of yourself. You can be nauseous and feel really queasy and really feel like not eating anything. That doesn't mean you're vomiting, okay? Let's talk about the drugs that are commonly used. The one that people tend to recognize the name of the most is Zofran, because it's used in people a lot. Zofran is ondansetron. And what it does, or what they think it does, is it blocks the nausea signal coming through the vagal nerve from the stomach. So everything in the abdomen is innervated by the vagal nerve. And it's hugely important in chiropractic stuff. But if you have nausea in your stomach, you or your dog or cat, it's all the same, for some reason, and the signal of that nausea travels up the vagal nerve to the brain and tells the brain you're nauseous, well then the Zofran that blocks the transmission of that pain or that nausea signal in the vagal nerve is going to work for that. But think about that. It's only going to work if the nausea issue is coming from the stomach, okay? Now, the next drug that I've been seeing used more often, that I don't necessarily think is the right choice, but sometimes it is Mirtazapine. Mirtazapine is actually an anti-anxiety drug that affects a lot of things, and amongst those things, it does affect some certain serotonin receptors and actions. And that can cause a side effect of increased appetite or maybe a little bit of the feeling of like the munchies. But by primarily being an anti-anxiety drug, it alleviates any social or emotional apprehension that the pet may have towards eating. This can happen in dogs or cats, but it happens more often in cats. Cats get anxiety and just refuse to eat for a number of different reasons. And that can be social, household, anything. It can be dogs and cats, but it happens more in cats. So if you have a pet who's not eating because they're having some anxiety about it, whether it's some different changes in the environment or the pet's life, or an older cat or older dog in kidney failure who doesn't feel good, they'll have some anxiety from that. And you won't see like storm anxiety or separation anxiety. They'll just be uncomfortable or unsure of the situation and they won't want to eat. So that's where the Mirtazapine for anxiety can get them eating again. And then the last one that used to be used more commonly, that I actually like better in this situation, even though I'm not normally a drug type person, is the Serenia or the meropitant. It acts specifically on the vomiting center in the brain. And it also affects the vagal nerve that innervates all the organs in the body and provides kind of some pain relief or analgesia to them. But primarily, its function is in the brain, at the center where vomiting, where the signal for vomiting and the perception of nausea is in the brain. If you block that, you block all types of nausea and vomiting. So this even works well for motion sickness that comes from the inner ear, and the balance has nothing to do with the gut. It'll still block vomiting and nausea associated with that. So it works in the brain, not anything about the stomach. So let's think about the kidney failure example, the older dog or cat. If there's metabolic waste circulating in the bloodstream and they're getting to the brain and they're making the brain feel nauseous, but it's not a stomach problem specifically, then the Serenia is going to work really good for this because it's going to block the feeling of nausea. And then lastly, if we think about the older cat that has anxiety and nausea, they may need both of these drugs. So these cats may need the Serenia to block the nausea caused by the metabolic waste products that the kidneys aren't removing, but they may also need the Mirtazapine, or frankly, we would rather have some other more natural homeopathic type of anti-anxiety treatment for cats, and there's a ton of stuff out there for that. You can find something for cat anxiety that doesn't have to be Mirtazapine. But the regular Western vet may send you home with the Cerenia and the Mirtazapine in this situation because they're both going to serve a purpose for an older cat, okay? But what I'm seeing more recently is they're just sending home the Mirtazapine without the Serenia, and I think the Serenia is needed for these animals. If you have had experiences with these drugs with your pet, feel free to leave a comment below, because your opinions and experience with these may really help other people who are also watching this video. So leave a comment if you have something to say. Thanks. If you found the information in this video useful or valuable or beneficial, then click the like button, which will tell the social media algorithms to show this video to more people who may also benefit from it. If you'd like to see more videos about a variety of veterinary health topics on my channels, you can subscribe to my Holistic Perspectives channel on YouTube, or you can follow my Veterinary Medicine 101 channel on Rumble. And if you'd like a consultation about your pet's health and wellness, or current ailments, or chronic disease, or about the care your pet's receiving from your local regular vet, anything about veterinary medicine, whether it's holistic or not, visit my website, drmattparker.com, to learn more about how to schedule a phone consultation. Thanks.